Heart disease may be common, but it doesn't have to be inevitable. Here are some tips to help keep your heart healthy and happy. Be active. 150 minutes of physical activity a week can protect your heart against bad cholesterol and high blood pressure. If you don't have access to the gym, try going for a walk or taking the stairs. Maintain a healthy weight. When your weight falls within a healthy range, your heart can pump blood throughout the body more efficiently. If you're above your healthy weight range, you're at risk for higher levels of bad cholesterol, diabetes, and high blood pressure. Eat a heart-healthy diet. Small changes to your diet can make significant impacts to the health of your heart. Incorporating fish, chicken, fruits, vegetables, and whole grains into your diet can help regulate your cholesterol. Quit smoking. Smoking increases your heart rate and raises your blood pressure, causing your heart to work much harder. Non-smokers are 2 to 4 times less likely to develop heart problems. Drink alcohol in moderation. Limiting yourself to only 1 to 2 drinks per day can keep your heart muscle strong. Excessive amounts of alcohol weaken the heart muscle. Manage stress. Finding healthy ways to navigate stress can increase blood flow to the heart muscle. Setting aside 5-minute intervals throughout your daily routine to focus on your breathing can reduce stress levels in your body and lower your heart rate. Of course, if you have any concerns about your heart's health, be sure to make an appointment with your primary care provider. Stay tuned for more from A Healthy Curiosity, a series by UT Health Austin.
Good evening, everyone, and welcome to the Mount Olive Baptist Church Centreville's webinar. Tonight, we will be discussing Heart in Action, turning healthy behaviors into action. At this time, we will open up with scripture from Sister Misha Adams.
Good evening.
Good evening.
Can you hear me?
Yes.
Okay. I will be reading scripture this evening. I'll be reading from Hebrews, the 10th chapter, starting at the 22nd verse, and it reads as thus. Let us hold fast to the profession of our faith without wavering. For he is faithful, and let us consider one another to provoke unto love and to good works, not forsaking the assembling of ourselves together as the manner of some is, but exhorting one another, and so much the more as ye see the day approaching. May the Lord add a special blessing to our time this evening and to his word. Thank you.
Amen. All right, let us bow. Heavenly Father, we come before you with gratitude for this space, this moment, and every individual gathered for this heart series. Thank you for placing within us the desire to care for our bodies, our minds, and our spirits, knowing that true wellness begins with you. Lord, today we ask for alignment between our intentions and our actions. So often we carry the desire to live healthier, to do better, to be better, but we ask that you give us the discipline, clarity, and courage to follow through. Strengthen our hearts, not only physically, but spiritually and emotionally, that we may walk in wholeness. We lift every person listening, those navigating stress, illness, transitions, or uncertainty. Meet them right where they are, provide wisdom for their decisions they make, healing where it's needed, and peace that surpasses all understanding. Bless the work of this ministry. Let it be a vessel that reaches beyond this webinar into homes, communities, and hearts, especially those that have been underserved or overlooked. Let this work be impactful, sustainable, and rooted in love and purpose. May what we learn today not remain as knowledge alone, but be transformed into action that leads to longer, healthier, and more fulfilled lives. We trust you with the journey. We trust you with the outcome. In your name we pray. Amen. All right. So I'm excited about tonight. So as far as the agenda, we already went through the welcome, the scripture, and the prayer. So housekeeping rules for those that have been with us before, everyone's mic is muted except for the speaker, but the chat is active. So please feel free to send messages during the presentation. And then, of course, at the end, we'll have questions for answers. We'll do a question and answer portion. So tonight is our 6th webinar. These webinars have been sponsored by a grant that we received from Potomac Health Foundation, our heart program, helping everyone access resources for total heart health, where we address food insecurity, undiagnosed hypertension, and we do these webinars to increase health literacy around heart and other meaningful topics. So tonight we have Heart in Action, turning healthy intentions into habits. Our next webinar will be Tuesday, April 21st. That one is Heart to Heart, the silent strain, hypertension, kidney disease, and the road to transplant. And our heart program team. So this team is led by Dr. Reverend Brenda McBurl, who serves as our Director of Community Outreach and Engagement. Myself, Dr. Sharmaine McCoy, the Director of Health and Wellness at Mount Olive. And then Dr. Faith Metlock, who is our Nurse and Research Scientist. And then we also have 3 clinical research assistants, Vanessa, Alex, and Anna. So very happy to have such a wonderful team that's dedicated and engaged to doing the work. All right. And so our speaker for tonight, I had the pleasure of meeting her in 22 when we worked on our first grant together. And since then, this has bloomed into colleague to friendship. So very happy to have you on tonight. And also happy to say that when we both met, we weren't doctors. So congratulations on getting your PhD. All right, so Dr. Tanisha Robinson is a PhD level licensed clinical social worker specializing in bariatrics and diabetes behavioral health. She obtained her master's in social work from Rutgers University, her PhD in public health education and health promotion from Walden University, and is working through a postdoctoral nutrition ISPP program with Virginia Tech. Dr. Robinson is dedicated to support you through health behavior, lifestyle counseling, weight loss counseling, and diabetes education. She also does bariatric psychosocial evaluations needed for surgical clearance. With a strong focus on lifestyle changes and health behavior modifications, she offers support with making health behavior changes via the curriculum of the CDC Diabetes Prevention Program to help you develop healthier habits. She was trained in lifestyle coaching that's offered through the diabetes program. She's in the process of pursuing a board certification in lifestyle medicine from the American College of Lifestyle Medicine and is currently training to become a registered dietitian. Dr. Robinson is passionate about providing comprehensive care tailored to your unique needs. In her spare time, she's usually found on the softball field playing competitive softball multiple nights a week, traveling, reading, or spending time with her family and cats. All right, girlfriend.
Good evening.
Good evening.
It is really nice to be here. As Dr. McCoy had mentioned, the first time we really kind of got into it was when we did something very similar to this. So I was very honored to be able to be invited back when she's doing her series again. So, and thank you for the introduction, of course. One of the things that I'm super passionate about is healthy behaviors. When I was in my residency and working inpatient, one of the biggest struggles that our patient population had was being able to make the healthy behavior changes that they were told they needed to do after they left the hospital or after they left their provider's appointment. So, for example, if the doctor tells you you have to eat healthy and exercise, well, what does that mean to you? What does that mean to your current lifestyle and routine? A lot of those things it just seems like if I just tell you, you'll do it. For those of you who have ever seen the SNL skit where one of the actors goes into a doctor's office and She's explaining to the doctor what's wrong, and the doctor says, just stop doing it. Just be happier. Just do this. As if that's like, all right, I'll bill your insurance, collect your copay, have a good day. No one really knows what that means in terms of you saying, just stop. And part of what's important when it comes to making health behaviors and lifestyle changes is it's predominantly psychological. And there is a big part of learning how to adapt it into your routine, learning how to adapt it into the routine that you have. So I want to make sure that I go kind of over what I do and what my role is when I work with my patients. Okay. All right. So what I teach my patients is, as Sharmaine had said earlier, I am working towards getting my board certification in lifestyle medicine. And essentially what lifestyle medicine is it is health behaviors. So it focuses on the 6 pillars, and the 6 pillars specifically are stress management, restorative sleep, reducing toxins, exercise and physical activity, healthy eating and nutrition, and then social connection. You all already meet the social connection piece, being that you all are a church family, and that spiritual connection that people have to you all is so important as part of the social connection. I know from running my church's health ministry and what we do there is we all know when somebody hasn't been showing up to events that they normally would have. We know when somebody has kind of been missing. We even know when people have been sick or out for any specific reason, because as a church family, we'll go check on them. We will make sure that they're okay. We have a term for people that are at our church that are called shut-ins. And essentially what that means is they struggle to be able to get out of the house, whether it's for mobility or health reasons or other things. And so oftentimes we kind of keep that list to make sure that they are just as included in some of the activities that we try to do. So whether it be we go caroling at Christmas time, we drop off different meals or other things, or just stop by to spend time with them. Social connection is actually a big piece, and you all are already living that through your church ministry. So that's one of the things. What I then work on with patients when they come in to see me usually falls along the line of the other 5 that I had listed. So being that I'm a behavioral health professional, of course, stress management is a big piece of what I do. And so I work with patients on how to navigate how stress could be affecting them. I'm sure several of us have had a history at least one time of maybe stress eating or stress snacking. And so that can affect, depending on what you're eating or how much of it, your health in general. So one of the things I work on is trying to redirect that behavior so that it goes from reaching for some kind of snack or food or even a beverage to doing something different to kind of distract yourself from potentially whatever that stressor is, as well as being able to identify that. So those are the things that I go over with my patients. I'm going to go through each of these pillars one by one as part of my presentation. And then please feel free again to put questions in the chat. And if I am able to pause, I'll get to it during it. If not, I'll definitely work on getting to it after. So this is from the American College of Lifestyle Medicine. It essentially explains what I do as a lifestyle medicine practitioner. So it focuses on therapeutic lifestyle interventions as a predominant modality used to help with treating and or preventing various chronic illnesses or chronic conditions. And many of the ones that we're seeing are going to be obesity, type 2 diabetes, and then cardiovascular diseases. Lifestyle medicine is training us to focus on the 6 pillars, and it not just be a here, take this medicine and leave. It's here, take this medicine and make these lifestyle changes so that hopefully you can reduce the amount of medicine you're on, or even just reduce how your symptoms are in general when you're dealing with a chronic condition. Or if we are in the pre-stages of something, how can we help you to adjust your lifestyle to then limit what kind of transition it goes. So from prediabetes to type 2, we're going to work on trying to either keep you at the prediabetes while we work on making the lifestyle changes to hopefully put that into remission and prevent you from getting type 2 diabetes. So that is effectively what lifestyle medicine focuses on, kind of everything outside of just the medication regimen. What are some of the other things that could be affecting your health outside of those things? Right. So, stress. Stress management can manifest in the body in so many different ways. One of the first things I learned about in my psychopathology class was a diagnosis called pseudocyesis. Had no idea what it was. When the teacher asked us how to explain it, I just said pseudo usually means something that's either not there or is kind of almost something. And that's effectively what it was. It was basically that you could stress yourself into a pregnancy, but it wasn't a real pregnancy. So your body manifested all of the hormones, all of the things that would normally happen during a pregnancy without you actually being pregnant. It's very rare, so please no one panic quietly from home. But it is something that shows how much stress can wreak havoc on your body. So stress essentially puts your body into fight or flight, and the stress hormones that get triggered, such as adrenaline and cortisol, can actually affect your body from a physical perspective. So in the short term, it can cause you to have hypertension or raise your blood pressure. It can weaken your immune system, and then it also can cause inflammation. I have heard of people having inflammation in their joints or just noticing more inflammation during times that they are very stressed versus like times that maybe they're not as stressed. And then long term, one of the other things I see is for any of my patients who have diabetes, cortisol can actually increase the levels of management in terms of your blood glucose. So it can keep your body from using the glucose effectively. And then that keeps your blood sugars high, as well as cortisol can trigger your liver to produce more glucose, thinking that it needs it. And then your blood sugar goes up. So these things can affect long-term how your body manages and metabolizes things. And that's why stress management in and of itself, outside of just the mental and emotional wellness that comes from it, can be managed in terms of also thinking about it from a physical perspective. I know personally, just for me, I've definitely had stress headaches in the past. And usually if it's not something where I am not feeling well or I have a cold or something that could have triggered that, I take a step back and I look at how stressed I am, how overwhelmed I might be with something, and then navigate, okay, what do I do now to be able to fix that? So stress can manifest in so many different ways, and it really is important to manage it. If you feel like that's something that you need support in, please feel free to reach out to your primary care provider or find your friendly local neighborhood mental health provider and get into counseling to work on stress management. Once you kind of have some of those coping skills or techniques down, that can really help with how you manage stress moving forward versus what you're doing now. All right. Restorative sleep. So Sharmaine noted earlier that I have 2 cats and I love them. This is not one of them. I wish it was, but this is not one of my cats. However, I put that here because I feel like sometimes I wish I could sleep as much as my cats do. So restorative sleep. That is important that the term restorative is in front of it, because that differentiates between those nights where you are sleeping, but maybe it's not the best sleep in terms of quality. Quality can be so important because it can help with managing your body's ability to recover from the day. So whether it was that you were exercising or moving a lot, or you were running around, or you have stress, or you're sick, your body needing to get enough sleep can help with making sure that it's restored and recovered by the next day. So getting enough sleep really is important for managing that. And that's why restorative sleep versus just sleep in general is important to note here. By getting good restorative sleep, you can prevent several things. And a lot of these pillars are kind of interconnected. So you'll see some of the same things in terms of short-term issues and long-term issues that could arise from potentially not getting good sleep or getting stress management, things like that. When you don't necessarily get good sleep or restorative sleep, that can trigger things like night eating or late night snacking. And that's something in the bariatrics clinic that I'm working with patients on actively to kind of help them with. If you're getting, 4 hours of sleep a night, try and inch closer to getting more like 8 hours. And we work our way up, but a lot of the time it's throwing off their hormones' abilities to manage their hunger. So ghrelin is a hormone that increases hunger when you wake up. And what it's supposed to do is when you wake up first thing in the morning, your body triggers that to say, hey, we are now ready to break the fast that we have had since yesterday after whatever the last time it was that you ate. Leptin is a hormone that decreases hunger so that you don't have a bunch of food noise ringing in your ear when you're trying to sleep at night that causes you to just wake up and always feel hungry, go back to sleep, wake up, feel hungry. So leptin is produced to help with quieting that. And when you're not necessarily getting consistent sleep or enough sleep, or it's not restorative, it can throw off not only your circadian rhythm, but also how those hormones are produced to help with regulating your hunger cues in terms of your sleep. So it's really important to make sure that you're getting enough sleep, that you're getting to bed on time. Try not to sit there and scroll on your phone or utilize social media. If you do need a level of noise in the background to kind of help you with relaxing, using white noise or the Calm app, or even guided meditation, plenty of audio on YouTube that you can access for free. Those things will help. I don't always recommend the TV, even though I know some people will knock out with the TV fully on. And it's just because the light can trigger your brain to think that that's like the same as sunlight, and then act as if you are awake and it's time to get up. And that can sometimes make it harder for people to then fall asleep. So usually audio is good because there's no light that's triggering your body to think it's daytime and it's time to wake up. So short-term issues that can affect your immune system. You can potentially have brain fog. I don't know if you've ever gotten not enough sleep and then felt like you don't know where your keys are, or you're forgetting small things. That can be caused by not having enough sleep. And then just a lack of energy in general. And then long-term issues could be insulin resistance, weight gain, and cardiovascular issues. So it can also affect your blood pressure and hypertension in general. So sleep does help the body to repair. So it is important to make sure you're getting enough of it. All right. So the next pillar is going to be focused on reducing toxins. And in terms of toxins, that's going to be smoking cessation, alcohol use, drug use. So the ones that I put up here are things that I do probably the most in my practice in terms of this specific pillar. And that's going to be nicotine or smoking cessation, and then limiting usually alcohol intake. Alcohol intake can affect weight management in the context of just lots of empty calories and sugar, depending on what you're having. And I know there are some people who sometimes will fill up in terms of the amount of calorie intake by taking in extra things like beer or wine while also still eating. And those calories can add up, which can lead to metabolic issues, can lead to diabetes, and it can lead to weight gain. Nicotine and smoking cessation. So the reason I put both is because people are not just getting nicotine or tobacco via smoking. There's vaping. There's also nicotine pouches that people just kind of stick into the sides of their mouths. Things like that are still giving you the nicotine in that sense. And a lot of what I see is when people start to do cessation is they don't have the support after they stop smoking. And that kind of fixation of I was always putting like a cigarette or a vape to my mouth transfers from it being that to I'm going to start snacking, because there's that fixation that you couldn't let go of necessarily. And without having the right support in terms of smoking cessation counseling and nicotine replacement therapies, you're potentially going to just snack through the entire day, depending on how much you were previously smoking or vaping. And I know I've seen a lot of my patients who, if they smoke cigarettes, they don't burn through as many as if they were vaping, because vapes are so easy. People are able to use them in more places, not necessarily true, but they do anyway. And the nicotine intake that you get from a vape is oftentimes much higher than what you would get from a cigarette. So it's actually more addictive as opposed to less addictive. So working on making sure that you're, keeping track of anybody that seems potentially extra stressed, because I know for people who are extra stressed, they tend to smoke more, helping to redirect them, but finding someone that can do nicotine cessation or smoking cessation is also helpful. Most mental health providers are able to give some general counsel on it, like an understanding or education on what it could be. But I know what I do is very specific, and I oftentimes work with the clinical pharmacist at my clinic where I work, or with people's pharmacists at their physical pharmacies to help with them navigating on a appropriate cessation plan using a nicotine replacement therapy to transition from smoking. If you do happen to notice anyone increasing in alcohol use than maybe what they normally would have been doing before, or increasing drug use, that's probably a cry for help of some sort. And it might be good to just kind of sit down and have a conversation, check in with them. You'd be surprised how much just checking in with someone can mean to them drinking less, to them seeking help, whether it be a counselor, rehab center, AA or NA support groups. Any of those things are going to be helpful. So just reaching out and saying, how are you? And checking in can sometimes make all the difference. So lung and respiratory issues can form from nicotine and smoking, hypertension and other cardiovascular disease, as well as cancer. All can increase by using some of these. But there are treatments out there. So please encourage people, if they are wanting to quit or wanting to, use less, encourage them to get help. All right. Exercise, movement, physical activity is another pillar. I put all three of these things because when I'm working with patients, I do differentiate between the three. Movement is going to be where you are just not as sedentary. So if you have a job where maybe you sit at a desk and are kind of staring at a screen, getting up and stretching, moving, lifting your knees up and down, things like that, that would be movement. Walking to and from the bathroom or around your office space, that's movement. It's generally that your body is used to this. It's considered normative. So it's at your baseline with whatever your baseline movement abilities are. And by not being as sedentary, getting up and doing that stretch, doing that quick walk around here and there helps with just any kind of prevention of weight management. When you're trying to not gain weight or you're trying to lose weight. Physical activity can be things like going for a walk. It's not necessarily that you are putting any extra vigorous movement into what you're doing, but it's more than your general everyday, I'm walking to and from the bathroom. So that would be physical activity. For some people, that's also a level of sports in some way. And by I say in some way, it means potentially it being more casual or not as intense. And then exercise would be viewed as something where your heart rate is going up. You're potentially not able to talk when you are doing exercise because your heart rate is going in a good way and you're maybe more out of breath. So with general movement, you're able to have a conversation while you're doing this. You're not out of breath. You're not struggling to talk. With physical activity, there might be some struggle to talk while you're doing it, but it's not anything where you're like taking a breath every couple words. And then with exercise, whether it's moderate or intense, there's more of a level where you cannot talk in the same way, or you're more out of breath because you're moving so much. Any of those three things, if you're not doing any of those three things, is really important. So I always say, if you're sedentary and don't really move a lot, even just getting up and stretching more at work in between meetings or in between events, and maybe like walking around, lifting your knees, that's better than just sitting in one seated position for 6 to 8 hours straight. So that's even a small step of improvement with just making sure you're moving. Physical activity. We're getting to that time of year where the weather is warming up and improving, and it's more likely that people will get out and want to go for walks. That's great. If you weren't doing that before, that's even better. So any little bit of improvement means that you're less sedentary and less likely to put yourself at risk for any of these cardiovascular diseases, for obesity, type 2, diabetes, any of those conditions that can come from having a highly sedentary lifestyle or not moving as much. So anytime you're doing any kind of exercise or physical activity, these are some of the things that I recommend, and it just depends on where you're at and where you'd like to go. And I do a slow build of forming your exercise habit, because it's not that if you went from, doing almost nothing to now wanting to do exercise at a high rate multiple times a week, that's not necessarily going to just happen overnight. It does have to be a slower build and a slower improvement over time, because at this point, you're now just trying to form the habit to be a part of your routine versus you thinking, oh, okay, I got this. I'm just going to go from 0 to 100. That's oftentimes how it can burn people out and cause you to have maybe a mindset of, I missed a day last week, so I can't do this, and what's the point? And then you just stop altogether. So that mindset is what we're trying to kind of focus on in the beginning by building the routine very slowly. And then we can build on that from there based off of what you're hoping to do long term. So it is a little bit of a slower way to get there, or a slower pace, but it's the right way to set the actual habit in place versus not at all. It takes 30 days to form a habit and 30 more before it's automatic. That's something that you can kind of remind yourself of and say as a mantra, that it takes time to really form things as a habit. And if you're trying to change or adjust the habit, that same thing applies. 30 days and then 30 more before it's automatic. So just keep that in mind when you're trying to set any of these goals. All right, so find your village. Social connection is so much more important. You're more motivated, you're more likely to do things, you're more likely to participate, your stress levels are more likely to drop, your sleep's more likely to improve. All of those things are affected by your social connection and the things that you have. Social connections can be something like friends, family, your church family, coworkers. Especially for those who have remote jobs and have not necessarily been told you have to go back into the office in some capacity. A lot of that social connection was severed during the pandemic, rightfully so, because of what was going on in the world and for safety reasons. But even when the pandemic became not a pandemic level, there were still people, working remote who might not have gotten out as much. And for those of us who are working remote and live by ourselves, that social connection is even more important, because you would have gotten some level of that at work at the office. So now if you live alone and you're working remote from home, you kind of lose that aspect. So being able to make sure that you connect with friends, connect with family, if you have a church that you're attending, that you go. Those are going to be so important, because you won't be able to connect in the same way with your coworkers if you're working from home. Older adults are also going to potentially fall into this, as they may deal with loneliness if they have a spouse and their spouse has since passed, or if they have a spouse and their spouse has a lot of health conditions that maybe kind of keep them tethered more to the home because they're not able to be as mobile or get out of the home. You're going to want to check on those folks, make sure they're okay. Caregivers or older adults who are living by themselves are more likely to experience health conditions and depression, and then higher mortality rates because of that. So by being able to check on any of our people, I know at my church, anybody who wants to come to church and needs a ride, we have a whole phone tree system where you can reach out and somebody will find you a ride to get you to and from church, Sunday school, or a church event. So there's never any barrier per se, at least for most of us. And I'm sure that, your church as well probably has a system like that to check in on its people, but social connection is important. It can lessen substance use. It can lower the rates of suicide. Even just thoughts of suicide can go down for people who have that social connection and a strong social connection. So make sure you check on your neighbors, make sure you check on your friends, because it is a big part of it. All right. Healthy eating. I think one of the first things that I learned about when I was going through my residency and I was in a diabetes clinic that the endocrinologist said was, you are what you eat. And at first I kind of have heard that before and just figured she was talking about junk foods, like don't do that because of XYZ reasons. But it actually translated into, that if you eat healthier, you tend to be healthier. So I understood once she explained it to me later that that's what she was implying. And so it can be something as simple as making small changes here and there. I, as a behavioral health provider and a budding dietitian, soon to be in the next year or so, I don't like to tell people no. Short of you have a food allergy to it, like this is life and death if you eat this type of situation, or any of my patients who have just had open heart surgery. Those are hardline no's. Those are my only two. But I'm not here to tell you not to go to Chick-fil-A or not to go out to eat or not to have something other than those two things. But what can we do to make a healthy option while we're there? So if you go to Chick-fil-A and you decide to get the regular breaded and fried nuggets and you want to get waffle fries, could you also get a side salad or a cup of fruit to add that level of the fiber that comes from the strawberries and the apples and things like that are in that fruit cup, in addition to what you're getting from the rest of the meal? Or if not that, could you do diet lemonade or a zero sugar soda in terms of that, so that your meal is just that much healthier, and it gets easier to then make other changes as you're getting used to that, and your body will get used to it and you'll start to feel and notice changes. I know a lot of my patients who start transitioning to eating healthier things, such as instead of having regular Coca-Cola, they'll have the zero sugar Coca-Cola or Diet Coke. That is something where they start noticing like, oh, I am, I do notice that I don't like things as sweet as I used to, because they're not having that sugar content as much as they were when they switched. So now other things taste too sweet or taste too, something, and it kind of steers them away from wanting it, and they actually lean into more of the healthier food options because they're like, oh, I didn't realize how much that was a part of my life. And then the same thing goes for fruits and vegetables. It's usually then easier to gravitate to getting your sweets from those, as opposed to only getting your sweets from other things. Again, not here to tell you no. If you want to have birthday cake, celebrate someone's birthday, that social connection is important, but can you have a smaller piece? Or can you, lessen a sugary beverage that you have with it and maybe have water that day for your hydration? Any of those things are going to be even just that much better and put you in just that much of an improved health stance, as well as lowering your risk for some of these other things. And it does take time, as I said, with other things, to just make the adjustment. And oftentimes what I see in patients is the anticipation of it is what's actually worse than doing it or making the change or even just starting to make that change. So in terms of making healthier food choices, it doesn't need to be an overhaul. Please don't go home and throw everything out in your fridge and cabinets or pantries. Start by saying, I'm no longer going to buy this, or I'm not going to buy as much of this. Finish what you have and then incorporate a different option. And if you need help with what options could be right for you based off of your health needs, based off of your culture, because that's important. I never want anybody to feel like my culture was wrong and the way that my culture eats is bad, because 9 times out of 10, it's not. There are other things that, could be mitigating some of that. So I never want anybody to feel that way, but how can we adjust it, make some tweaks here and there? You get accustomed to that, start noticing a difference, and then we make other tweaks until you're at whatever point you'd like to be with your health goals when it comes to nutrition and eating. And nutrition can also affect your mood and your emotional wellness. It can make or break how you deal with stress. It provides fuel. And for those of us who have probably experienced it, which I'm sure is everyone watching this, you can become hangry by not eating and having a low blood sugar. So making sure that your eating can affect that, so that way you don't get that way, so that you don't start getting snacky or cranky if you have not had anything to eat in recent times. So those are the 6 pillars of health. That is what I work with all of my patients on. And I don't do all 6 of them at once. We usually see what areas there are for improvement potential, and then we go from there. We pick out 1 or 2 that they feel like is something that they either feel they can do based off of their current routine or lifestyle, or that they'd like to focus on. Because at the end of the day, it's about what my patient wants to do and feels that they're able to do, and we'll work and build on that from there. As I'm sure you saw in the presentation, a lot of these overlap in terms of what they do and don't affect or change. So oftentimes by just tweaking and adjusting one, it helps to then bounce off and tweak and adjust the others without even necessarily having so much thought. All right. Well, that's the end of my presentation, so I'm open for questions that anyone may have.
All right. Well, that was awesome. Thank you so much for that. I did put one question in the chat.
Okay. All right. So the question was, how do I know if what I'm feeling is stress versus anxiety or burnout? So what I'll say is stress is often a symptom, whereas anxiety is potentially a larger form of that. So everybody feels stress in some way. It's a natural part of life. It's a defense mechanism that your body normally goes through to let you know that something is happening. So you could feel some stress around school, right? You have a big test coming up. Even if you feel really prepared, you could still be nervous about it. That was me with all of my boards. I was very prepared, but that didn't mean that walking into that testing center, I did not feel imposter syndrome and that I was going to fail. So that would be an example of stress. It's usually a response. Oftentimes people can feel it physically. Sometimes heart rate goes up a little bit, and you're a little more heightened and maybe a little more hypersensitive and aware to different things. If that feeling is more ongoing as opposed to situational, right? And by situational, I mean appropriate situations, such as when I was taking my boards. That would be a situation where we might expect some level of anxiety or stress. When it becomes chronic and it's for almost everything. So you just woke up in the morning and you're anxious and you're constantly worrying or, constantly thinking about things, that spiral that you have. That could be more clinical anxiety. And the best way for you to know the difference between if you're still in maybe like early stress stages versus moving into generalized anxiety disorder or a different type of anxiety disorder would be to go and either see your primary care provider or to make an appointment with a mental health professional. And burnout is something similar, and it's usually affiliated with one specific thing. And so you can be burnt out from one thing. There are levels to burnout, right? So you can feel burnout at work during a very busy time of year, right? So I imagine accountants probably do feel burnout during tax season, for example. And then usually for the rest of the year, April 16th on, it's a lot quieter for them in terms of that. But it doesn't necessarily mean that they are burnt out from being an accountant. That's just a very busy time of year. And so there's a lot going on. Lots of plates are spinning all at once. And sometimes it can be good to make sure that you meet with a provider, mental health or otherwise, to learn stress management techniques so that the burnout doesn't lead to you making mistakes on the job or in whatever the thing is that you're doing that could lead to it being hurtful to someone else or hurtful to yourself. So there are levels to it, but the best way to kind of know which situation applies to you, or if you have a couple of situations that might be applying to you, would be to definitely go talk to a primary care provider or your friendly neighborhood behavioral health provider.
Awesome. All right. So anyone else, any questions? I dropped one more question in the chat. Okay, Miss Linda's question.
Yes, I was just reading that. How can you increase leptin? Sleep aids don't help with increasing your body's production of it. Your body will produce what it needs to. And a lot of the time it's going to be that you get back onto a regular circadian rhythm. And if your body is lacking in leptin, that's potentially going to be something that can be seen in labs if you feel like it is. But most of the time, your body produces leptin in when it's supposed to, just like it produces ghrelin. So a lot of the time, what I tell people is if you work on getting your sleep schedule adjusted to like going to sleep shortly after you have had your last meal or snack, right? So for example, if you say, I'm not going to eat anything after 7 or 8 o'clock, then I would make sure that like you do whatever activities you were planning to do that evening, have a nighttime routine that usually starts about 30 to 45 minutes before you plan to be laying down and in bed, and then be in bed usually no more than 3 hours after you've eaten. And that's so that way your body is not triggering to say, oh, you've been up for, this long and your last meal was 3-4 hours ago. So you are hungry, time to go get something, when you might legitimately not be hungry in that sense. It could just be that you're up and need to go to bed. So it doesn't necessarily trigger for your body to produce more or less. Oftentimes your body produces what it needs for you to go to sleep. It's just a matter of actually getting to sleep, and then your body will work through all of those different things. All right, so Miss Carol's question, how do you trigger weight loss while going through menopause and aging? Good question. So actually in the bariatrics clinic where I work, we, on the obesity medicine or non-surgical side, we do navigate menopause. And I think actually the medical director for the program is going through a menopause course and trying to get certified as a menopause provider, as well as one of our nurse practitioners who is going through her DNP program. She'll be finished in May of this year. She's also then planning to take the boards for menopause management with regard to weight. It's a tricky question for me to kind of answer right now in the context of menopause and metabolic rate are affected differently in a lot of people. Some people will go through menopause and not gain weight. Some people will go through menopause and potentially lose weight. I know some people who go through perimenopause have their weight management struggles through perimenopause, get to menopause, and everything levels out or is fine. The best way to kind of navigate what could be happening is to see an obesity medicine provider. And an obesity medicine provider does not mean that they are going to prescribe you an anti-obesity medication. It's just the same as like sleep medicine. That's just the name of the specialty. But by finding someone who's board certified, they can make sure that they run any labs, do any tests, and then work from there to see Is this something medical going on? Is this something with your hormones? Are there other things that are being triggered by it that are causing some of the weight gain? And then usually if it's a comprehensive clinic like the one that I work for, there'll be all of us there, the medical provider, the clinical pharmacist, the behavioral specialist, dietitian, and usually if they can, they'll have an exercise provider, but if not, myself and the dietitian go over exercise management as part of the treatment plan when you're working with us. So I'd say it's not necessarily about how, because it's going to be case by case. So the best thing that you could do is find an obesity medicine provider and have a consult with them to really understand holistically what's being triggered by your menopause.
All right. We'll wait a few more seconds, see if anything else pops up. Only other thing I added was one takeaway from your message tonight. If you had to just give one additional nugget, what should they remember?
I would probably say manage your stress. So much of the other 6 pillars can be affected by stress. If you're experiencing higher amounts of stress, it can affect how well your sleep is. It can affect that you might start snacking or having cravings and reach for things that you probably wouldn't normally when it comes to eating habits. It can trigger increased toxin, as it's called, use. So if you're already smoking, you might smoke more. If you're already having a glass of wine here and there, you may find yourself having more than one glass with regularity. Every one of these 6 pillars can be affected by stress. So please, if nothing else, manage your stress so that it doesn't trickle down into the other areas of your life or the other 5 pillars.
All right. All right, my friend. Well, thank you so much for joining us this evening. As always, it's a pleasure. I love you, love you, love you. As I said, our next webinar will be on Tuesday, April 21st. So thank you for everyone that was able to join us tonight. And the webinar will be posted on Mount Olive Baptist Church's YouTube channel to be viewed again. Have a wonderful evening and a blessed week.